Hello and welcome to the GRACE podcast series. My name is Denise Brock and I'm the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast, members of the GRACE Board of Directors, Dr. Jack West, Dr. Jared Weiss, and Dr. Ben Levy all sat down in their respective homes to have a candid discussion regarding COVID-19 and how it affects primarily cancer patients. In this 4-part series, the doctors discuss testing, risk, preventive measures, ongoing cancer treatment, and many other issues relating to a cancer diagnosis in the middle of the pandemic. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Let's turn to another question, which is, if you have cancer, do you have a higher risk of developing coronavirus infection and related to that, more serious complications from COVID-19, the syndrome of symptoms associated with it? We know it's potentially life-threatening. We also know that some people are asymptomatic carriers. And so what's your understanding about the risk to patients who have cancer relative to everyone in the population? Jared, can we start with you?
So I think you're getting into a realm, and either of you feel free to interrupt me if you know more than me, where we're really relying more on logic and common sense than hard data. We do have good data that patients with comorbidities are more likely to suffer severe illness. And these comorbidities can be even mild things that as cancer docs, we don't normally think of as comorbidities like hypertension or diabetes. So certainly it makes sense that our cancer patients are at much higher risk of severity if they were to get coronavirus. In terms of the risk of getting it, I'm not aware of hard data at this point, but some of our patients do have weakened immune systems, secondary to what their cancer's done to them, secondary to what we've done to them, particularly with those on cytotoxics. Again, extrapolating some common sense without hard data to prove I'm right, I would suspect that elevation of risk probably does not extend as much to our immunotherapy or targeted therapy patients. Are either of you aware of harder data to supplement that logic? And if I'm going to be honest to our audience, speculation?
I would say that there's very scant data. It's just little wisps that are coming from Wuhan, China, or from Europe, from Italy. And it's really smallish numbers, but there are strands that are just coming out. There's a preprint in Lancet Oncology about pooled results from China that suggest actually that patients who are on immunotherapy and also patients who have undergone surgery are at higher risk of doing poorly. And, maybe a little counterintuitive, what you might think that chemotherapy is a considerably higher risk because you're immunosuppressing patients, as you alluded, and many of us have been more hesitant about recommending immunosuppressive standard chemotherapy in this environment. But we are also getting glimpses, and still in the middle of learning about this, that there may be a series of cytokines or chemicals in the body that are related to inflammation that may be increased and contribute to the harmful effects in the setting of coronavirus, and that may be triggered by immunotherapy. And also when we see patients who have had surgery, whether they are also in a kind of inflammatory setting, immunosuppressed perhaps, or just having undergone a cancer surgery and therefore have more exposure to coming into the clinic or being hospitalized for an extended period. I don't think we know this yet, but there's just these early threads that we at least need to be aware of the potential higher risk, little hints that patients with cancer are overrepresented for infection with coronavirus and more likely to have adverse effects, particularly lung cancer or metastases to the lung. Again, this was just coming out as a preprint in Lancet Oncology, I believe, in the last 24 hours. So this is, all stuff that we are learning in real time, and much more still to learn. Ben, any other thoughts?
Yeah, I just want to put just a reminder to put these, these numbers in the context of the overall numbers, which is that, 85%, 80 to 85% of patients who contract this generally can remain at home. Roughly 15 to 20% have to be hospitalized. And of those 15 to 20% that are hospitalized, it looks like 15 to 20% of those need some sort of mechanical ventilation. And of those, you get down to those who unfortunately have death from as a consequence of complications. So, are certainly scary, and I'm not trying to besmirch the pandemic or any of the complications, but we need to be mindful of the fact that 80 to 85% of people do get over this without hospitalization. We need to be careful about those that may be more vulnerable and mindful of how to triage their care. But, I've had so many patients calling saying that even they got exposed to somebody with COVID positive, that turned out to be COVID positive, and this must be the end for them. And I just want to remind folks of the larger data set that we're seeing.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly, Novartis, Takeda, AstraZeneca, and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.